Statins have made a huge difference in declining death rates from cardiovascular disease, so this statement is not accurate. Let me show you some data from 3 different countries. This data is from the CDC looking at cardiovascular death rates from the 1900s onwards, and I want you to focus in on the 1940s onward. In the 1940s, we really got a better understanding the role lipid particles play in atherosclerosis. That's when our understanding that high fat, high saturated, fat diets contribute to atherosclerosis. So in the 1960s, there was a lot more public health efforts towards telling people lifestyle changes such as reducing saturated fats can help reduce the risk of cardiovascular disease. So you start seeing a decline in the 1960s. At the same time, we also understood smoking plays a vital role in cardiovascular disease. So there was more public health intervention for that. So the 1960s were all about lifestyle changes, and you see a drastic decline with that. Then in the 1970s, vascular interventions like angioplasty came into the fold. So people are actually actively having heart attacks. There were interventions to save their lives. So you see a decline from the 1970s onward. Then in the 1980s, statins came into the fold, and our understanding that when you further reduce LDL particles and other atherogenic particles using statins, you get a further reduction in cardiovascular disease. So you see that sustained decline in cardiovascular death rate from the 1980s onward. This is coronary disease death rates from Australia, and the same decline you notice from the 1970s onwards with lifestyle changes, percutaneous interventions, and in the early 80s introducing statins into the mix for risk reduction. You see this same effect in many other countries. I didn't publish the UK data. I couldn't get a good screenshot of that. But since the 1970s in the UK, drastic reduction in coronary disease deaths, largely due to lifestyle interventions, percutaneous interventions, and statins. And one other bit of information nugget to ponder about. Remember, since the 1960s, despite these decreases in cardiovascular death rates from all the things I talked about, across the board, we've seen a drastic increase in the rates of obesity and type 2 diabetes, which are both also risk factors for cardiovascular disease. So despite exploding rates of obesity and type 2 diabetes, why are we not seeing an upswing in cardiovascular death rates? Well, it's for all the reasons I've highlighted. We're managing to mitigate the effects of cardiovascular disease despite increasing rates of obesity and type 2 diabetes. We're telling people to smoke less. We're managing their hypertension better. We've got better medications, statins, and so forth. So people are living longer with cardiovascular disease despite increasing rates of obesity and type 2 diabetes over the last 20, 30 years, largely because of many of these interventions, including statins. So remember, there is a lot of misinformation on social media about statins, a lot of fear mongering. It's really important you talk to people who understand evidence-based medicine, like internal medicine doctors like myself, cardiologists as well.